Thank you, Manorama ji, for also giving a very nice summary upfront. So I wear three different hats. One is, of course, I'm a public health professional. Secondly, as you mentioned, I'm a policy professional. But I think one of the most important hats is that I'm myself a patient of a very rare form of lung cancer, and I think that gives me a very unique perspective to all these discussions. So I think first I'll just talk about the allocation, because that's what you want me to address first. I don't believe it is adequate. I haven't believed it is adequate for many years now. We are a country of 1.4 billion people, as was shown on one of the slides. To be investing this amount in health is just grossly inadequate. I've heard that argument countless times that it's not about the quantum of money, it's about how you use that money. And sure enough, that's true. But quantum is also important, and if you put in so little, then it is always going to be problematic. So I think that, and actually, if you look at the numbers, if you remove that COVID blip, when we actually had a big, jump suddenly in one of the years because we had COVID vaccination and we had some 35,000 crores budgeted for that. But if you remove, some of those blips that we've had, and adjust for inflation, then actually you're not left with too much, of an increase. And remember that we start from a very low base. We've always underinvested in health and in public health more so. So I think, for public health professionals like me, and even, when I was working in the Niti Aayog, I used to put it across as forcefully as this, because I think if people like us don't speak, then I don't know who will. And I don't know when that realization will dawn on us. As you said, that healthcare is one of the most critical pillars. But I think we still see it as an expense. We still see it as an expenditure. We don't see it as an investment. And I think it needs a lot more voices. Like I keep trying to raise mine. I think you have to multiply that by a million, or many more times, for the real decision makers to see it as not an expenditure, but as an investment. Because if you're talking of Viksit Bharat, you're talking of your workforce. If your workforce is not healthy, it is not productive, then I don't know how you can build a developed economy. So it is not just an expense, it is actually an investment for your future, for your economy, to become a developed nation, to become a happy, productive society. So, in that respect, yes, India, it's predominantly a state subject, health. So, states have a big role to play as well. I wouldn't take away from the onus on them, but I still feel that the center needs to do a lot more. Of course, we'll come to the other semantics later, and the other aspects of the budget and the implementation issues. But I think even in terms of quantum of funding, we surely need to do much better for a sector which is so critical for the country and for the economy.
Thank you so much. Thanks. I take your words the way you said the healthcare as we take it as an expenditure and not as an investment. And I also agree with you when you said we need to ensure a roadmap for sustained investment beyond incremental annual increases. Now, I would like to ask you a bit of like the budget has said about having 200 daycare centers, cancer care centers. And do you think that these centers will improve, the actual, the care for these patients and improve the accessibility? And what are the challenges if we look at India's, reaching the last mile? What are these challenges? And what does the customs duty, exemption of customs duty, if you can decode it, like 36 life-saving drugs, making cancer treatment truly affordable? If you can decode these things for us, it would be really nice. Over to you, Dr.
Okay,
Prasad.
yeah, thank you. So, I think on the cancer care centers, again, I think that the devil lies in the details of the implementation. Like most things, when we announce it, of course, in theory, nobody can disagree with it. That we need it, at the district level, because most people, like was also said, I think Arjun said it, that most people are still traveling to a Delhi or a Mumbai, and so having that cancer care closer to where people are certainly will be more convenient, more affordable for them, and could lead to even better outcomes, because a lot of times the distance you have to travel is quite a deterrent to going for your regular monitoring, etc. So I think in theory there is no debate that it would, in my mind, that it's a great idea, but the execution is everything. And we are talking at the district level. We need to see, do we have enough qualified personnel? If not, what is the roadmap for training and putting those personnel there? What is going to be the supply chain for the medications? What are the kind of services we're going to provide there? Because cancer care, so a few years ago we had an announcement of dialysis similarly at the district hospitals. Dialysis is still one intervention. Cancer care can be a lot of things. So what are we going to provide there? Is it just the basic chemotherapy? Are we going to do more things also? What is it going to entail? And what will it take to really implement it well? I think that is where the question is in my mind, because like you said, you read out the figures on the Ayushman Arogya Mandirs. Now I've actually done a study on these, when I was at Niti Aayog, and that's what we found, that the gap between what is stated on the guidelines and the numbers on paper and what we see on the ground, in many places that gap is still vast. And even in terms of screenings, right? So on the website we might say, okay, we screened so many people, but it doesn't really tell you how often did we screen them, how systematic was it, did we refer those people? Suppose I screened and I found a certain number of people needed referral. What did I do with that? Did I follow up with those people? So I think those are the real questions, right? I think the numbers look great, and in India we can often run into showing that we've done lakhs of this and lakhs of that, but the actual quality, as somebody who always likes to go on the ground and see, okay, what's happening here, and there's always a lot of mismatch in many areas. So I think that is a concern with the cancer centers. But I think on the customs duty, again, we need to see these drugs individually that are being talked about here, and to what extent their costs are coming down, because some of these drugs truly are out of reach, for majority of India's population. Even for someone like me, I'm on an oral targeted therapy by Pfizer, and it is so expensive. So even if you cut the cost of it by a certain percentage, it's still, it is very expensive. You also have GST, you have other things that you have to look at. So we need to see which are these drugs, how do patients access these. Patient access programs often don't work for a lot of poor patients, because I get poor patients coming to me almost every day that the patient assistance programs are not working for us. So again, nobody can dispute the intent behind doing some of these things, but everything will come down to the details and the execution. And I think that is the question I have in my mind, because cancer care, if I'll just quickly conclude on these questions, is it's a whole package. You can't just look at it as bits and pieces. It's everything from prevention, screening, detection, diagnosis, treatment, and then rehabilitation. We don't even get to that part. So it's a whole, and I've been advocating that we need a comprehensive cancer care program, instead of kind of fitting it into different schemes and saying, okay, there's a little bit in Ayushman, there's a little bit here, there's a little bit there. We need a much more comprehensive and holistic approach, equally to tackle the financial issue. And that is why I'm saying that just the customs duty coming down on a drug, it might still mean that there's still a lot of burden, because the treatment is a much broader thing and there's many more elements to it. So yeah, those are my thoughts on that.
Thank you so much. Thanks, Urvashi, for explaining